Hello again. Okay, so I have already told you about antihypertensive drugs, right? The definition of antihypertensive drug, definition of hypertension first, then definition of hypertensive drugs. At first, definition of hypertension, then antihypertensive drugs, right? Then after that, the classification of antihypertensive drug. Right, all these things as AC inhibitors, diuretics, angiotensin antagonist, alpha beta and adrenergic blocker, alpha 1 receptor blocker, central sympathetic, calcium channel blocker, beta adrenergic blocker, vasodilators, right? Then we studied about AC inhibitor drugs, right? We studied the definition and the mechanism of action of AC inhibitors, right? So let's see the drugs, indication, contraindication, side effects of AC inhibitors. Okay, so let's start. AC inhibitors drugs name. Okay, let's see: captopril, ramipril, enalapril, fosinopril, lisinopril, benzapril. We will you will find a similarity between all these drugs, that all these drugs ends with pril, right? So I have a suggestion: remember April when it comes to AC inhibitors drug name. Okay, remember April. This is how you will remember: captopril, ramipril, enalapril, fosinopril, lisinopril, benzapril. So remember April, this word. Okay, yeah. Let's see the indication of AC inhibitors. Indication means the patients, to whom we will give these drugs. Okay, so yeah, hypertensive patient, obviously, congestive heart failure patient, myocardial infarction patient, diabetic neuropathy patient. Okay, all these are patient can take AC inhibitors. They can take AC inhibitors. Okay, yeah. Now let's see the side effects of AC inhibitors. Okay, so yeah, I have a suggestion at first. Let me show you. Remember captopril. We studied here, na? We studied in the AC inhibitors drug classification, na? Captopril. One drug name is captopril. So you will remember that, in the side effect point. Remember captopril. This is how you will remember: cough, dry cough mainly, allergic reaction, potassium elevation, taste change, edema, photosensitivity, renal failure, ingestion, and low blood pressure. Okay, so captopril. Okay, so yeah, captopril. Remember captopril. So I remember like this. So it now I memorize in this process. Now it's up to you, right? And let's see the contraindication now. Okay, contraindication, this is D. So let's see the contraindication. Contraindication means in this condition we can't give AC inhibitors. We cannot give AC inhibitors. Okay, indication means we can give AC inhibitors. Contraindication means we can't give AC inhibitors. So if the woman is pregnant, so we can't give. If they have any renal disease, then we can't give. If they have allergy of AC inhibitors, then also we can't give them or advise them AC inhibitors. Okay, I hope it's clear. Okay, so now we will study angiotensin antagonist. Okay, AC inhibitors completed, so we will start this angiotensin antagonist. Okay, so let's start angiotensin receptor blocker. Let's see the definition. Okay, angiotensin receptor blockers block the action of. Okay, angiotensin receptor blockers is same. Okay, angiotensin antagonist and angiotensin receptor blocker is same. Okay, in case you have any problem. Okay, now let's see the definition finally. Okay, so angiotensin receptor blocks the action of angiotensin 2. We have studied, right, in the mechanism action of AC inhibitors, that angiotensin 2 are responsible for increasing the BP. So angiotensin receptor blocker what? Blocks the action of angiotensin 2. So it result reduced blood pressure. I hope the definition is clear. Now let's focus on the mechanism of action. Mechanism of action is similar to mechanism of action of AC inhibitors. Let's see, all the process are same. first processes are same. Like liver produces angiotensinogen. Then when blood pressure decreases in our arteries, kidney will know that, okay, kidney will detect that, okay, the blood pressure is decreased in our arteries, let's produce renin. So kidneys then produce a molecule called renin, okay. Then what renin will do, renin will go into the circulation, renin will, after going to the circulation, renin will convert angiotensin to angiotensin 1, okay, angiotensinogen to angiotensin 1. Then after angiotensin 1 will circulate into the body, okay, they will roam around into the body and contact with membrane bound enzyme called ACE. Means ACE mainly found in lung tissue, okay. So angiotensin contact with ACE. After that ACE then convert the angiotensin 1 to angiotensin 2. Now we know that angiotensin 2, now it will do its action, it will do its action of increasing the blood pressure. But then comes the angiotensin receptor blocker, they will come and they will block the angiotensin 2 function, okay, receptor, angiotensin 2, the function of angiotensin 2. Then after that automatically the blood pressure will be decreased, okay. I hope it's clear. If you have any doubt, let me know. Thank you.